and also a great opportunity to bring you a story that inspires this morning. Our next guest has responded to the COVID-19 pandemic in her own unique and caring way. After seeing the devastating impact of the coronavirus on her own community, this medical doctor decided to open a free clinic for residents testing positive for the virus in Chatsworth. Dr. Diveshni Govender joins us now to tell us more about this incredible journey. Dr. Govender, it's a great pleasure having you on the show this morning. Give us a sense of how it came to be that you set up Havenside Community Outreach.
Okay, so we're all well aware KZN was hit very hard by the second wave. We were leading in terms of active cases, and Chatsworth being very much a hotspot, we had overwhelming need for medical treatment. But with that came with the fear of going to hospital. And we had patients not seeking medical treatment due to that fear and complicating at home. So I felt the need to bridge the gap between not seeking medical treatment and going to a hospital facility. Also, our hospitals were hit very hard in the second wave, and bed crisis was a major problem in our surrounding areas. So we had to do something in order to bridge the gap and help people with COVID-19.
So you're providing free medical care to COVID-19 patients in your community. I mean, this is on the back of stories that we've heard about people showing up with COVID-19 symptoms at hospitals and being told that they first need a deposit to the hospital running in the thousands of rand before they can be helped.
Yes, so with the financial difficulties people experienced in 2020, this was almost impossible. So we decided to go ahead and put out a facility where we can give interim care free of charge to many who are required. All we required from you was a positive COVID-19 result, and we offered you treatment.
Now, I'm reading an article about Havenside now, and it quotes you here as saying, this is not ideal medicine, this is pandemic medicine. What does that mean?
Okay, so in most settings, there's a lot of T's and C's setting up a medical center. We, as a community, and as myself being a community doctor, came up with this idea to utilize a facility. We're not an extension of any hospital setting. It is completely just a basic hall that we now converted. And this is based on donations. So there's always criteria placed in from Department of Health. We need X, Y, and Z. So we now trying to just get the community together to give help, give treatment, support one another. Hence, it's not ideal. We do not have everything, but we do have a triage system, so where we can take care of the needs of the people on an interim basis and then refer them upward to hospital or down, refer them back to their homes with treatment.
Yeah, and your facility is running completely off of donations. Having said that, you've still been able to set up 15 beds that are able to take on COVID-19 patients.
Yes, we initially came up with this initiative. It wasn't planned to be a bedded facility as such. As one of the images you showed, we were initially set up with just a few beds for the very frail, and the rest were chairs. But as we continue to treat patients, we realized beds were a better option as people are fatigued. And we asked sponsors to come on board further to give us more beds. And we subsequently went on to a 15-bedded facility. We can go a little bit higher, but at right now, the 15 beds are working for us. And in terms of our staffing and myself being the only medical doctor available at the facility.
Yeah. So in terms of the extent of COVID-19 patients that you are able to treat, what are the COVID-19 therapies that you are equipped to deal with at your facility?
Okay, so we are seeing patients with mild to moderate disease. So we're looking at patients with saturation between 85% and 92%. We offer them oxygen therapy. We offer them intravenous fluids, intravenous drugs from analgesia to antibiotics, steroids. We also offer them treatment for home, from antibiotics to steroids to menthol crystals, both therapeutic, medical and therapeutic measures. We also have the advice from physiotherapists and OTs that are assisting us, and we do send them home with information packs on breathing exercises and how to work forward. And we have a WhatsApp line if they have complications at home to contact us, and then we advise them further how to get medical help or where to go. And if a patient, for example, is still requiring oxygen therapy despite the interim oxygen, we do offer them an oxygen concentrator to take home on a rental basis free of charge.
Sure. And so are you saying that patients aren't necessarily admitted, like they don't stay at the facility for days at a time? This is daily treatment, yeah.
Yes, this is daily interim care. So ideally, we see you, we treat you, we assess you at the end of treatment, whether you're stable enough to return home, or do I feel that you need to intensify your treatment and be referred to a hospital.
Yeah. So you talked about being the only medical doctor at the facility. What does your staffing consist of?
Okay, so currently, when this idea of mine came up, I was the leader in terms of this. Subsequently, we have hired 2 nursing staff. We've got an admin clerk, and we have a janitor for the facility. We are supported, surrounded by physiotherapists and occupational therapists.
And do they give their services? They provide their services free of charge, or are you also depending on donations to pay them?
So the physio and occupational therapists are free of charge in terms of advisory and motivation. They are free of charge as well.
Yeah. In terms of the future of Havenside community outreach, as we start to look post-COVID-19 now, do you see it as a long-term facility for the community in Chatsworth?
We have already had an outcry for this to continue post-COVID as an outreach. And if facilities avail us and funding avails us, we will consider it as a community effort moving post-COVID. As our next step of COVID is continuous prevention and vaccination, we hopefully will be involved in some sort of vaccination campaign coming to the future. But as my focus on treatment now, we're going on to more prevention as school opens. So we're trying to secure donations and funding for the poor schools around us and the poor community in terms of face shields, masks for these kids. So we're going across the board from treatment to prevention and hopefully vaccination as well. And once hopefully COVID has left us, we would like to continue as a community clinic. Sure.
I mean, on that score, as a long-term solution to some of the deep needs in the Chatsworth community when it comes to community healthcare, for someone who might be listening and who wants to contribute to Havenside community outreach, how do they do that?
Okay, so there's various platforms they can communicate with us. We do have a Facebook page. It's called Havenside Community Outreach. All information is posted on that page. They can like the page and they'll get the contact details. If they like to contribute, we've got a list of medical, non-medical supplies and a banking account available on that page. So all communication can go via this page.
All right, great. Dr. Diveshni Govender, thank you so much for the incredible work that you and your team are providing to the community there in Chatsworth. Incredible stuff in the midst of a pandemic, finding our own solutions. Thanks so much for joining us here on the AM Report. And if you are watching this interview, wondering how you can perhaps help Havenside Community Outreach, there is a Facebook page by the same name. Go ahead and like that page and you'll get all of the contact details there.